Hello, my name is Victor Logan. Thank you for looking at, I believe this is our first video on YouTube with Midwest Benefits LLC out of Omaha, Nebraska. And what we're going to talk about today is the top 8 reasons single people don't buy health insurance. You know what inspired this for me was that a friend of mine, acquaintance rather, on Facebook was looking around for health insurance, and was trying to find something inexpensive, something that was cheap. And lo and behold, that's one of the top 8 reasons single people don't buy health insurance is that it costs too much. And here's the thing. Should a catastrophic event or illness occur in your life, the chances are good that it'll bankrupt you. I mean, you'll be done, all right? And when I say bankrupt, not only will you be bankrupt, but you'll be sick while you're going through it, okay? You're looking at 10 years on your credit report minimum. Your credit rating's ruined. All right, you're done. You're finished. So when you look at that versus, all right, paying what, 90, 100, 150, 200, 250, $300 a month, all right, versus what, 100,000, 150, $200,000. This is cheap. No, health insurance does not cost too much, all right? So, number 2, it does not cover all the healthcare needs that I have now or might have in the future. How would you know that? Here's the thing. A good health insurance broker can usually find a policy that covers most every medical problem that you might have now or possibly in the future. The thing of it is that you're going to have to do some research. All right, you're going to have to take some time out of your life, take a look at a number of different policies, and see which one best fits your needs. Now, I think a major mistake that a lot of people make is that they don't understand the difference between an insurance broker and an insurance agent. Insurance agents tend to be captured, and what that means is that they can give you everything from column A, all right? Because that's all they got is column A. Column B, column C, column D doesn't exist. You just get column A. And that means that you're sitting here like this with the blinders on. You can't see anything to the left or the right when you're dealing with these people. It's always best to deal with an insurance broker because they bring a lot more to the table, all right? Something to think about. The third reason that single people tend not to purchase health insurance is that the drug benefit is insufficient on most healthcare plans. Well, that simply isn't true. That isn't true. It's a matter of research, taking a look around, all right? There are a number of healthcare plans, more than I can count out there, and lots of benefits, differences between them, all right? Normally you'll be able to find something that works within your budget and meets the needs that you have. Number 4, the process of finding the right health insurance is too complicated. Oh, good God. I know people who will spend weeks, months even, looking at all the features and benefits over a telephone or a notebook computer, an iPad or something like that. I mean, they'll really dig in and get into this, right? But they won't do that with health insurance, something that affects their life. This is one of the most important decisions that you're ever going to make, all right? Because it affects your life, your health. Why would you see that as being more complicated than an electronic piece of equipment? That's the kind of stuff that just doesn't make sense to me, all right? What you need to do is get in there and get the research done, all right? It's not that complicated. It's real complicated when you don't do it, and then you have to deal with a major catastrophe in your life or a major problem in your life, and then that's a problem. Then it's real complicated, okay? It's not complicated when you do the work. Number 5, I have a specific health issue that was not covered satisfactorily in the past. Therefore, I'm not inclined to buy health insurance again. That is, without a doubt, the stupidest thing that I have ever heard. All right, that's like saying, look, I got a bad drink of water, a couple of weeks ago, and I'm never going to drink water again. That's just stupid. That's what it is. Okay? You got to realize that not all policies are the same. There's definitely one that is right for you, and it's just going to take some work to find it. Like I said, you got to do due diligence. All right, this is important. This is important to your life and to your health and to your family's life and health. Why wouldn't you take the effort to find out? All right, why would a telephone or a notebook computer be more important than that? And if it is, then you got your priorities messed up. Number 6, I am healthy and I do not need health insurance today. Well, we got today covered. What about tomorrow? The fact of the matter is, you're a human being. You're probably going to get sick. More likely, at some point in time in your life, you should carry health insurance. All right, that is a known risk. It's a fact. You're probably going to get sick. Why wouldn't you have health insurance? This should be obvious. All right. Number 7, Obama will help me get free insurance. Obama will help me get free insurance. That's a good one. This is a pretty common theme that I hear often. It's unfortunate that we have a portion of the population that is this naive. All right? I could even go so far to say this ignorant. All right? If you believe that, then you need to stop smoking stuff that's not good for your mental state. All right? The U.S. government is not going to give you or anyone else free health insurance. All right? The only people who get free health insurance in the United States of America are the 15.9% of the population who are on Medicaid. All right? That's for the poor. Now, if you're poor, you're going to get free health insurance from the government. 15.9%. You're part of the 15.9%, great. You got free health insurance. You're not, you're going to have to pay for it. And that's just the way it is. Deal with it. Number 8, I'm going to wait until health insurance is cheaper. Okay, I've been doing this for a long time. Let me tell you one thing about health insurance. It never gets cheaper. It only goes up in price. All right, never seen it go down. Always see it go up. Every single year, it goes up. It never goes down. All right, that's not likely to happen. If you're one of those people who are waiting for it to go down, then you're a green apple. You're one of these people who feels much more comfortable with the comfortable lie than the uncomfortable truth. And the uncomfortable truth is that health insurance does not go down in price. It always goes up. And if you want to have it, then you need to get in now so that you can get used to paying for it. Look, people, we're going to have mandatory health insurance in this country by 2014. I know a number of people seem to think that's not going to happen. There's 27 lawsuits going on all over the country here. It's before the Supreme Court. This same thing happened with Social Security back in the 30s. There were 3 or 4 lawsuits on that. Do we have Social Security today? Yes, we do. And I know there are people out there who will even say to me, well, that's different. Okay, maybe it is, maybe it isn't. I'm not going to argue constitutional law with you or anything else. I do believe that by 2014, you are going to have to make provision to pay for your own health insurance because it's going to be mandatory in this country. You should just get used to the idea of having that come out of your paycheck, either privately or through your employer. If your employer offers insurance, you need to be in that program. All right, you need to be under their plan because that's a group plan. It's a good deal. If you can't, or you're with an employee that doesn't have a group plan, then that means you're going to have to buy your own plan, and they're not that expensive. Get with a broker. All right, I'll be more than happy to help you. Get with a broker. Find a plan that fits your budget, that fits your needs, easy enough to do. All right, it's only going to take a little bit of time and some research, but it's well worth it. It's your life, your health needs to get done. All right, stop whining about it, get it done. All right, I want to thank you guys for looking at my video. We'll do more on health insurance, life, health. We're also going to talk about money and how money works in American society because it's really important to insurance on the general whole. Once again, thank you for watching my video. Have a great weekend. Bye.